All right, guys, so for the Berlin, it's going to be a lot easier, more straightforward. We are actually not going to turn the Berlin on because turning it off and on so many times over the course of a week will probably shorten its already very short lifespan. So we're going to kind of work with what we've got. So what you guys are I'm gonna have everything set up for you, but the first thing I want y'all to show the nurses is this kind of like pretend pump. So basically you'll just show them, you know, these are the valves, this is your blood chamber, this is your air chamber, you've got the membrane separating the blood and the air chamber, and then you'll want to ask them when the membrane is moving towards you, is that fill or eject? The correct answer to that is fill. And then when the membrane is moving away from you, is that fill or eject? The correct answer, that is eject. And then on the skills by device, there's also identifying factors and settings that would influence fill and eject. So if they don't have enough volume, that would be a big one that would influence like a low fill. And then if there is a lot of afterload, so if the patient is agitated, in pain, or just simply has high blood pressure, that would cause an incomplete eject. So just talk through those kind of things with the nurses, and you can keep it pretty basic. So that's what you'll use the demo pump for. And then for the ICUS itself, we're actually going to use these compressors that come with it that are going to simulate a pump. So it's not actually a pump, it's these compressors, and they are attached to a drive line. So you're just going to pretend like this is a drive line going to your patient. I've got these cheat sheets, so you'll just go through this with the nurses. Just reiterate safety checks. You want to make sure you always know where your backup ICUS is and where your hand pump is. The hand pump should be right here under the laptop, and I want you guys to have the nurses practice hand pumping. So it's pretty easy. These just pretty much, like, it's a slight twist to the right and pull. It happens shockingly easily. You're going to have them go red to red and blue to blue, and then just practice hand pumping. You want them to go at a rate of between 60 to 80. So if everyone can just practice kind of getting hooked from the ICUS to the hand pump and actually hand pumping, that is one of the skills. And then you put the hand pump back right here. And then the last skill is just logging in to clear the alarms. And like I said, we are not actually going to boot this up. So you can just kind of show them here. Your user ID and your password are all here on the cheat sheet. So they're just gonna press 1 and then a pause. It'll ask for your password, 111, enter. And then from there, you can press 7 to scroll through all of your past alarms, or you can toggle over to where the alarms are, and then just remind them to log out once you're done checking the alarms. So that's really it. Just going through the safety checks, telling them how to log into clear alarms, and then practicing hand pumping. So this one will be pretty easy. Like I said, we don't have to actually turn this on. So yeah, and then we'll do more just in time. When we do have a Berlin on the floor, we'll do more just in time education with the pump, with the laptop actually on, so that everyone has a chance to practice. But for now, really all they need to know is to know the membrane, fill and eject, hand pump, and how to log in to clear the alarms. When to log in to clear the alarms is another thing that they may ask, and that is if the same alarm has occurred at least 3 times in the span of 10 minutes, you're going to have to log in to clear your alarms out so it stops beeping at you. Or another way to know is if it keeps beeping at you, then you'll have to go in and clear it out. So that's the Berlin. It should be pretty short and sweet compared to the HeartMate 3. And again, y'all just call me if you have any questions.